Great. All right. Thanks everyone for joining us. I think we're going to go ahead and get started. We're really glad that you're able to join us for this webinar on the practical guide for engaging with mobile operators in mHealth for RMNCH. My name is Francis Gonzalez, and I'm the Global Health Officer for mHealth here at the UN Foundation. It's great to see so much interest in this topic, and we hope that this webinar and the guide itself will help you navigate the challenging issues around MNO engagement. And so my colleague Tigist Tamrat is going to go ahead and give a brief introduction of how the guide came together through her work at WHO with GSMA. So go ahead, Tigist.
Great, thank you, Francis, and thank you all for joining us. This is indeed a very hot topic for all of you that are involved in mHealth, and kind of the history behind this document. It predates a little bit of the time now, but the IWG mHealth Catalog Grant Mechanism is an initiative that was started by the UN Foundation, funded by NORAD, and also then supported by WHO. And what this mechanism does is it provides grantee support and also technical assistance to selected mHealth projects that are on their way to scale. And during discussions with the selected mHealth projects, one of the common issues that we confronted was dealing with mobile network operators. So what we then proceeded to do was engage with GSMA, who is the lead in anything related with mobile network operators. And we asked and we commissioned them to conduct a series of interviews with both mHealth service providers and also mobile network operators to try to figure out what exactly is the disconnect, what can mHealth service providers do and present themselves in a way that would allow mobile network operators to listen to them and potentially see if there's any potential for partnerships and constructive engagement. So this has been going on for the past 2 years, the interviews, and it was finally culminated in this practical guide, which we hope will be useful to you. And now we are going to have a webinar to kind of go into more of the details so that we can iron out some of the frustrating questions that you all probably have. And with that, I'll give it back to Francis to introduce our guest panelist.
Great, thanks, Tigist. Yeah, so just to give a brief introduction to our webinar speaker today, we have Willie Ngumi, who is the mHealth technical expert on the GSMA Mobile for Development team. And prior to joining GSMA, Willie worked with the CDC Foundation in Kenya and provided technical support for the conceptualization, design, and deployment of mHealth applications through public-private partnerships. So Willie has both the expertise at GSMA and then also having worked on similar types of programs as more of an implementer. And so maybe just before Willie gets into his presentation, just a few pieces of housekeeping. The first being that we'd ask that you please hold any questions until the end of Willie's presentation, and we should have plenty of time for questions after. And when we do get to that portion of the webinar, you should be able to go under Manage Participants and click Raise Hand if you have a question, and then Tigist or I can lower your hand and unmute you so that you can ask your question, or you can go ahead and type your question into the Q&A section that's below. And yeah, other than that, just to say that we're recording this session and it'll be available afterwards as well. So I think with that, I'll hand it over to Willie to go ahead and get started. Thank you.
Okay, thank you very much, Francis and Tigist. Good afternoon all. It's afternoon here. It's a pleasure to be here, to be part of this forum. I hope to take you quickly through 7 slides, just recapping some of the findings from what the work that was done, and then spend a bit of time responding to some of the questions that were raised, which we have received, and they all seem to demonstrate some of the challenges that many of you have faced on the ground interacting with mobile operators. And we're definitely hoping that the guide will be very useful in both preparing your approach to mobile operator and also how to sustain the relationship. So I'll just go ahead and begin. So again, we're trying to look at practical ways to engage mobile operators. And just as a summary, it's important for sustained collaboration. There needs to be an understanding of the value that each party brings to a partnership. And I think most of the time that's where things sort of begin to fall apart. So it's important to do that, and we'll share a few of the ways in which you can successfully communicate that. And then finding ways to leverage whatever strengths or value that each partner brings. So one of the summary items is seeking alignment as much as possible. So it's important to understand some of the goals and objectives that the mobile operator has, and the mobile operator also needs to understand some of the goals and objectives, and generally a strategic direction. For example, you might find mobile operator is interested in increasing the use of mobile money on its network, and understanding that could help align either your project interest. So we have come across several ML projects that are looking at disbursement of funds through mobile money, and this kind of alignment is important in trying to get traction with mobile operators. There's also an opportunity for broader partnerships or services to increase value for consumer and operator. And this is simply, each one has a very specific service that you wish to deliver, be it messaging or data collection, and it's good to explore what other services would complement yours. And this again highlights the need for more collaboration within the mHealth space. If you're dealing with maternal and child health, and there's two implementers that have two specific services they wish to offer, seeking an opportunity to partner or perhaps bring the services together would increase value both for the consumer and the operator. So broader partnerships are useful. Collaboration between different service providers may be necessary. So you may find yourself needing to collaborate with one or two other implementers in your various countries in order to present a larger picture or better value both for users and the operator. And then strategic rather than tactical view. So often people approach a mobile operator with a very specific service in mind, and you're probably requesting for discounts or zero rating or a certain number of units, whether it's SMS or call time. It's important to also look ahead and see what else can this service evolve to, and begin to consider that even when making a presentation. So exploring opportunities beyond immediate service offerings. So right now it's stage-based messaging targeting pregnant women. What else could it be? And being able to share that future potential with an operator will get them more interested in the service. And then lastly, or last but not least, feedback to mobile operators is important. In many cases, projects will negotiate for concessions or favorable rates with mobile operators and implement a project, but never really turn back to go back to operator and say, for X amount of discount or X value of services that you gave us, this was the impact that we had. If that was happening frequently, you would find mobile operators beginning to understand more and more some of the outcomes and impacts of the services that you're delivering. And that would make them more interested in the whole in the area of mHealth, because they can see what the outcome is. So many of them end up just seeing either discounts or lost revenue opportunities rather than seeing the actual impact. So it's good to share that. And I think the document we have also has some of the proof points that mobile operators will be looking to and to understand so they can continue their interest in mHealth services. Other important considerations, what's the value proposition for the mobile operator? and some include opportunities for increased revenue. Perhaps your service creates an opportunity for use of mobile money to settle payments, and that's a revenue opportunity for a mobile operator. So being able to share that and see how your project or your service is able to create revenue opportunities is important. And then where partnerships require discounted services, what are the benefits, the non-revenue or intangible benefits for the mobile operator? That again increases the interest in the service that you're looking at. There's also the question of direct engagement or through an aggregator, so whether it's a content aggregator or a technology aggregator. So direct engagement again allows you to negotiate directly with the mobile operator, but it increases the effort of integrating. So if you're running a project, you need to have technical know-how in-house to set up shortcodes and VPNs that will allow you to reach out for SMS gateway and so on and so forth. So it increases that effort of integration. However, as much as you can share your value proposition directly to the operator. On the other hand, use of an aggregator may cost a little bit more in terms of per unit of the service, but it significantly reduces the effort to integrate because they already have systems that are plugged into mobile operators, and more often than not, they're plugged into more than one mobile operator. So if you're looking to serve a market that has 3 or 4 mobile operators, then an aggregator then will ease the process of connecting to all these mobile service providers. So it's a give and take, and it's important consideration when you're looking to roll out an mHealth service, is whether you have in-house capacity for that technical bit, or would you trade off a bit of the cost for ease of access to more than one mobile operator. Another important consideration is existing MNO assets and capabilities. So looking at what the current mobile providers are able to offer, is it voice, SMS, IVR, and so on and so forth, and trying to leverage that as much as is possible. That creates an interest because mobile operators have invested significantly in infrastructure. So whatever services can utilize this infrastructure better would be of interest to them. So for example, they've set up mobile money systems, and if you're going to use that, that is of high interest to a mobile operator. Or if you're going to integrate some of their billing services, then it's good use of their current resources. And then end user training requirements for existing technologies is much less effort. So if you use technologies that are already widespread and available on a mobile operator, it also reduces the effort you require to train end users in the service. Challenges in shared value. One of the challenges we've seen quite frequently, and many of you may have experienced, is perception challenge. So whenever implementers are approaching mobile operators or vice versa, there is always a wrong perception that sometimes will hinder getting some traction. So the mobile operator may feel you don't value the investment and all you want is free messages, and so they become a bit hesitant to really listen and engage. At the same time, implementers may feel that operators are profiteering, for lack of a better word, and only interested in making money. And so right from the onset, those two perceptions, sitting around the table to agree becomes a difficulty and quite a challenge, because everybody at the back of their mind has reservations. Then the other challenge is definition of value. So the definition of value drivers, either from commercial or non-profit angle, sometimes are different. So commercial entities want to drive value for brand and revenue. That's value that they find. And implementers, you're looking at outcomes and impact of interventions on a given population. And so sometimes finding a middle ground, again, whether it's language or just understanding, has proven to be quite a challenge in terms of shared value. And then differing expectations. In the commercial environment, timelines are very short. When you speak to a mobile operator, the first question they ask is, how long is this taking? Is your content ready? We have a timeline of 6 months. While in the development space, that takes a bit of more time, depending on stakeholder engagement, identifying a proper approach based on the population that you're targeting. So these kind of differing expectations also do pose as a challenge. So by the time you approach mobile operator and clarify your approach and stakeholder engagement, the mobile operator has lost interest because it's taken 3 months, 4 months, or 5 months. So those are some of the challenges that we've experienced and we've come across, and we'll talk about a bit later. And some of them are actually the questions that were asked. So to the right of the screen that you see, I've tried to illustrate how sometimes it's the language or perception, but yet there is commonality. So on the top, you see a government wants to serve its citizens, say in a given village or given town or location. Mobile operator, on the other hand, wants to increase its market size or increase its reach. And at the bottom, you see the implementer has a very specific target population they need to reach. And for the donor, it's geopolitical reach. They need to be able to reach their Eastern, Southern, or Western Africa, just as an example. And right in the middle of all of that is a mobile user. So this mobile user could be a pregnant woman who has a mobile handset, is of interest to the government, is of interest to the mobile operator, is of interest to the implementer, and is of interest to the donor. So being able to sit down and have, even if not the same viewpoint, but understand that you all have similar objectives that you're trying to achieve, creates room for understanding and for better partnerships. It's the same user you're reaching. It could be that the mobile operator has a poor signal in that area and they wanted to strengthen it and are looking for good reason. And here's a good reason. You have a program that's targeting pregnant women or children in that location. The government has an interest in that because it's the citizens, and same with the donor. So being able to try and see the user and understand the different perspectives and at the same time how it's the same user that you're targeting, then can bring everybody to the table for common understanding. So, like I said, it was going to be brief. I do have questions that were fielded, and I'll try and go through them as quickly as I can. But in conclusion, mobile operators are willing to engage. However, their own internal processes have a very concise definition of value of service. So, and that's where the interaction needs to happen between implementers and mobile operators to understand how do we speak the same language, how do we say things eye to eye. So for most mobile operators, revenue is a primary consideration because that's how they get to run their business and sustain the business. However, if well presented, other values like brand or reach or CSR impact can be considered if they align with the mobile operator strategy and direction. So that means when you present something to a mobile operator, even if it doesn't have a revenue stream to it, but you can clearly identify how this will either enhance the brand or enhance the mobile operator's reach or CSR objectives, then it creates an opportunity for partnerships. So again, these are a practical next up from the publication. So what values does the service bring to the mobile operator, whether it's impact on health outcomes that they may consider from a CSR perspective, or it may give them some leverage in terms of competitive differentiation. In some markets, you end up having to launch a service, for example, one mobile operator for starters, and that gives them a competitive advantage. So they have interest in that. Effective use of MNO's capabilities. So whatever technology they have, if you can use that, utilize it well, and perhaps more than just one. So for example, using voice, IVR, SMS, and mobile money, then that becomes of far greater interest in mobile operators. And of course, diversification of revenue streams, an opportunity for new revenue. That's there, then it's important to be able to share that. And then what value does the partnership bring to the service? Having the two of you in a partnership, what value does that add in terms of the assets that the MNO brings? So again, usually it's network and reach, and then or technology. Then the assets that the mHealth provider brings, usually a lot of knowledge, a lot of expertise and experience, and most of the time an intervention that is actually useful to the population. And then minimization of external implementation risks. So again, in terms of government, most of the time implementers will have a good relationship with government, and they can bring that to the table. So the service is launched that the government approves of, and the mobile operator can benefit from that as well. Then alignment of commercial terms. Again, if you're going to have a revenue being generated from this service, it could be a cost sharing, a revenue sharing model, or otherwise it's important to have alignment on that so the partnership can be successful. That said, we do have a few key resources that we'd like you to look into that help you answer the question, are you ready for partnership? And one of them is a service maturity tool, which was developed in the GSMA. And it's useful for evaluating the maturity of mHealth products and services relative to other similar products. We have a URL there and it's available, so you can actually use it. And it allows you to enter some details about your current service and some parameters. And then based on other similar services, you can begin to tell the level of maturity. We foresee that becoming a key tool to sort of increase the maturity of products, because when you run it the first time, it will give you an indicative score. And then if you run it again with time as more services are benchmarked, then you can begin to see what else is lacking in your service that other services may have used. For example, one area it talks about is, are you compliant with regulations that are necessary for your service? Maybe the first time you think you are, but when you run the service again, you realize there's a communications policy that you never thought about, or there's a health policy that you may have missed out on that is important to with regard to your service. And you can then access these resources, align your service towards these resources, and then profile yourself again and see again how do you rank among similar services. And then we also have the mHealth assessment and planning for scale tool, which was developed with WHO and several partners, which will be released very soon. This is useful in evaluating several things that you need to consider, considerations for scale, be it capacity, resources, finances, human resources, and it helps you think through it. If I want to scale, what do I really need in my organization or in my product and service to be able to reach more people with the service? And then for governments who are looking to understand a bit more about services, then there's an information and communication technologies for women and children's health. It's a planning workbook for multi-stakeholder action. So it can help governments reach out to stakeholders and improve the impact of services. So thank you very much. That was just a brief. You do have the document that was released. So we hope you spend some time looking through it and beginning to see what value you can add to your existing services. And Francis, I think with your permission, I'll go ahead and field some of the questions that we did receive.
Yeah, that sounds good.
Okay. So the questions are quite interesting. We have come across them quite a few times, even when we go on the ground in country, some of our projects, they are very pertinent questions. So I'll state the questions as they were and then give a response. So one of the key challenges that's been identified is variable mobile network operator coverage, and what has been stated as a relative disinterest in a disorganized private sector structure. So in response to that, mobile operators exist in a competitive environment, and coverage often is based on where there is a return on investment. And it could also be driven by other non-revenue objectives. For example, if there are populations that have been identified as hard to reach and there's an opportunity to provide mobile connectivity, that could drive mobile operators to develop the network. But developing a network and expanding a network can be fairly expensive, right from licensing to acquiring equipment and the right to set up base stations in various locations. So often it is quite frankly driven by where revenue opportunities exist. So the infrastructure is set up and it begins to pay back. If revenue was not a consideration, then it's possible to reach the entire country, but it would be a huge investment that may not be making significant return. And then again, the other challenge faces that, as I was saying, is they're business motivated. Everything we have to work with them should generate income, and there's a need for balance between social development and profit maximization. So with regard to that, income is actually what enables the operators to provide services on a continual basis, and also to expand network coverage and service levels. So at one point, you do need mobile operators to be able to roll out networks to harder to reach areas, but for them to do that, they do need to generate revenue. As much as the mHealth contribution towards revenue may be minimal, it's usually their primary consideration is revenue opportunities. So without income or even just being able to cover the basic cost of service, it would be difficult to expand a network and provide the services that are needed. So yes, the cost of service must be covered, and that means revenue. And then profit is what enables additional investments in networks. So whether it's rolling out and you realize there's a certain area with only 2G network and you wish there was 3G network, it would require the operator to make profit to be able to invest in a 3G network or a 4G network or anything else. So yes, they are business motivated, agreed, but like I mentioned earlier in the presentation, depending on your partnership, if you're able to demonstrate other value, whether it's brand or CSR or other such value, then those are also considered as reason or business case to engage in a partnership. Then there was a challenge that it was difficult to get mobile operators involved in the importance of some of the activities that you're doing, some of the projects that you're doing, and support them, whether it's through budgeting or promotion. And there was also the question about how to engage a non-receptive MNO. And at this point, I'll assume it means they're probably not liking the idea that you're presenting. And again, for this, I'll say it's part of the engagement that's needed. If operators are approached purely for service, so for example, you approach an operator and say, we'd like to buy a bundle of 1 million SMSs, then that is purely commercial. It becomes difficult for them either to discount because it's a purely commercial transaction. However, if you engage the operator to understand your project, your objectives, potential impact, lives that will be saved, children's lives that will be impacted, they begin to identify other values with which to engage you with. So the first approach is purely business. You need connectivity, you need modems out there, you need SMS or to backend for call center. That's purely commercial. But if you begin to engage them by demonstrating what the outcomes and impacts of some of the projects you're doing are, then it gives them an opportunity to find other values other than revenue that they can use for business case. And then on that basis, they can then begin to identify what other resources they can lend to the project, whether it's marketing, technical expertise, or service needs, maybe discounts or other such things. So it's important that your initial approach be based on trying to demonstrate what the value and the impact of these services are. Then they can then try and find reason to engage with that. Some of the other questions we have is how do you maintain a mutually benefiting partnership with MNOs? Again, keep an eye on the identified values and benefits for all the partners engaged. As I mentioned in the slide, find time to share the data, the reports, whatever you're identifying and finding on the ground based on the mHealth service, share this back with the mobile operator. They need to see these other value and benefits, not just the fact that they've discounted 1 million SMSs or they've given you so many free minutes of call time. They need to begin to see what value, the impact that you're having on the population, and then they can begin to take a longer term interest in the projects that you have. That question was how to have the MNO be aware that our product adds value to them. So again, it's similar to what the previous question. Clear communication and agreement on value is important at the beginning, as this is what builds a business case. And then throughout the program implementation, it's important to feed back to them as a partner. Again, if you get a discounted service from a mobile operator and you feed back to them the impact that you're beginning to have or the outcomes, they then begin to see the discount from a different light. It's not lost revenue, it's life saved. And that can go either into CSR or marketing or brand, that they can use that to strengthen their brand, to demonstrate that they're actually saving lives or impacting children's lives or pregnant women's lives through these discounts or through these free service or whatever the engagement would be. So the question, how can we scale it to community level? Again, when planning for scale, there are important considerations around resources that you need for the increased scope and increased activities. This could be groundwork, the partnerships that you need, financial health of your project or your service, technology requirements, architecture, or any operational or M&E things that you need to consider. And so there are several tools that are available, and like we mentioned in the presentation, I think I can try to keep back that slide. So the ML assessment and planning for scale tool. That's an important tool when you're looking to scale, because it tries to identify key elements that you need to have full consideration of. So in time, like I mentioned, it's resources, financial health, what technology you now need to scale up. Does your architecture of the service change? What else do you need to do as far as your operations are concerned? And then, how do you draft a business case to win MNO support? I guess the theme has been recurring. A business case must demonstrate value for the mobile operator for them to actually engage with it. And these values need to link to some of their core activities. So in the MNO engagement guide, the guide that's been published, there's a section that talks about the proof points. And some of these proof points is what operators use to determine interest. Are what the impact is expected to be, what opportunities there are for maybe revenue. It may not be for the immediate service. So, for example, you could have a service that is free for a certain level, and then users wanting more information and then pay for premium service. So again, that presents a revenue opportunity while still meeting your basic need to distribute information or to have access to information affordably. So several of the proof points are there. Please do take a look at the proof point section. I think it should be chapter 6 of the document. It highlights some of the thoughts that you need to have as you develop a business case. But at the end of the day, it needs to demonstrate some value. What's in it for the mobile operator? What's in it for you as an implementer as well? And then some of the other challenges raised is who should you target within a mobile operator? Is it CSR or is it marketing? And what message? And also there's a question, what is the best way to determine who in a given mobile operator to contact regarding collaboration on an health project? So for this, I would say it depends on the value proposition. As I mentioned, you may have a service that you wish to have a basic part of it free and the rest of it could be revenue driven. For example, or a community health worker system that enables stipends or allowances to be sent to community health workers out in remote areas via mobile money or mobile wallets. This kind of a service creates an opportunity for revenue through mobile money for the mobile operator. So the best people to approach would be the marketing team because they can see an opportunity for use or leveraging of their existing services, which include mobile money. And it does have a revenue element to it. The cost of transferring money is revenue for the mobile operator. So that would be the best approach. They will then look at the commercial value, the business case, and determine how else we can support that kind of a service. If, however, on the other hand, you have sort of a pilot for either messaging or data collection that is aimed at demonstrating the efficiency of mobile technology for such for behavior change communication or task shifting, then you may want to approach the CSR because it may be a limited number of users. For example, you target to test the service with 20 or 30 community health workers or focus groups, maybe 40 pregnant women, for example. So that wouldn't really be a revenue consideration because simply because of the number of people that you're looking at. But it does demonstrate value for mobile services. So CSR probably is who you would approach for that kind of a service. Because then the CSR team would be interested in the outcome. What was the impact? Did mobile actually improve behavior change, or did it improve how data is collected on the ground and submitted to central systems like DHS? So CSR will tend to be interested in that because it has social impact, however small the cluster is. Again, this resonates with the recommendation that you need to be willing to share the outcomes and impacts of your services with mobile operators. Whoever it is that you've engaged with that has given you a discount or has given you a concession, share that data with them. Explain to them, for you it was a discount. It was a 50% discount on SMS. But for us, we're able to reach so many women, and this has actually been the impact. That is really important, and I couldn't emphasize it more than I have. There's a question about the disconnect between local business units and executives who engage in strategic alliances. Local business units are ultimately responsible for revenue, profit, and business continuity in any country. So strategy, perhaps at the group level, are responsible in general for the future direction of the mobile operators. So however, with all things global and regional, local know-how is actually what runs the day. I think many of you are in implementation of programs and you realize you may have the same program across 3 countries. So at the global program level, it's the same program, but once you go in country, then you have to rely on local knowledge. You have to tweak your program slightly for the different audiences. So it's the same thing with mobile operators. Group has strategic direction, but the local operator or the operating company has the last say in terms of exactly how to engage with the local market, because they're on the ground and they understand some of the challenges that they face. So some programs may work at global level across 2-3 countries, but in some countries it wouldn't work the same. So local business units tend to have the day at the end of the
Really?
Yes.
Hey, I'm just looking at the time. I think this has been really helpful, but I was wondering maybe we should move over to questions from people who are on the webinar now, just so that we don't end up going too far over time. And I know Tigist has gotten some of those already, and I'll invite everyone else, if you have questions, to please submit them through the Q&A section below. I think that'll be easier than trying to raise hands and ask your questions using audio. So if you have questions, please submit them there, and then Tigist will be able to read them out to Willie. So yeah. Go ahead, Tigist, with the first ones that you have.
Okay, so we have 4 questions asked by 3 different people. Let's just start maybe with the shortest one, which is, have you had any success in engagements with MNOs? And if you can actually try to provide a specific example of that partnership. Should I read out all the questions to you? Maybe we'll do two and two. So if you can cite any successful engagements that you've had with MNOs. And then another question that we'll take is, in your experience, how important has it been to have the government participation for an mHealth project as an incentive for the MNO to enter into the partnership? So how critical is that government engagement to MNOs? Let's take those 2, and then I'll send you the rest after those.
Okay, so in terms of successes with MNO engagement, I think one that is actually fairly well developed at this point is in Malawi. In Malawi, one of the implementers we came across in our nutrition project was Village Reach. So Village Reach ran a health center by phone service called Chipatala Chakoponi or CCPF. And it currently is reverse bill service. So they have been using donor funding to support pregnant women who call in for advice in general. And we also have Airtel in Malawi, who have had a strong interest in being able to develop call a doc service so that their subscribers can call in with general questions on health and get referred to the right kind of care, attention, be it a health clinic or and so on and so forth. So we have a case of two distinct organizations that are trying to achieve the same goal. Each of them has a leverage. The mobile operator has the network, they have the capacity and the technology to scale. And on the other hand, Village Reach have invested significantly in well-trained professionals who are able to listen in, ask the right questions, and sort of determine the right way to handle the inquiries. So as part of our engagement in Malawi, we brought the two together. And I would say they are sort of finalizing an engagement where they will be able to bring their partnership, their strengths together. So Village Reach will be able to provide a back-end professional support to the call center, while Airtel will be able to provide a front-end or be able to advertise the short code or for dialing in or to call a doc service and help Village Reach to scale, not just to one additional district, which will be the initial test of the partnership, but literally to be able to scale nationwide. So the value of that is that they both identified a common interest. Village Reach wants to serve Malawians who have questions, whether it's on pregnancy or general questions on health, through a mobile phone. And Airtel also has an interest in providing a call a doc service to its customers. So bringing the two together simply means each of them has a strength that they now leverage in partnership. The second question, how important it is to have the government engagement. I would say it has been critical. We are aware that a lot of mobile operators have launched various health services, whether it's health tips, and the authenticity of messages is critical, both to sustainability of the service. Users want to know that the health advice or information I've received is valid, not just in terms of correctness, but is relevant to my situation and my country. So in our project, we have a content work stream that is aimed at generating localized content that's endorsed by government. It has been very important, and mobile operators have taken a very keen interest simply because they know they can launch a service that will not be pointed at fingers by the government because it's using approved and endorsed content. So yes, especially in health, the government engagement is critical. Unlike, say, architecture or other stuff where there is wide-scale industry standards, health tends to rely on government in most sub-Saharan countries.
Thank you, Willie. And on that point, I'm just going to lead into two other questions. So one is, given that MNOs have short timelines, how can we best keep them interested or engaged while we also do the stakeholder engagement with the government, which actually takes a while? So do they have to choose between MNOs or getting a government on board, since both can facilitate sustainability, considering the the differences in the timelines of the two key stakeholders? Another one is, how can implementers best capture the non-revenue benefits of MNOs for an mHealth service? For example, the HNI with GSMA did some good work in quantifying the stickiness of Airtel customers who use their 321 service and how much more they use other Airtel services versus non-321 customers. This seems like a lot of work, but is there any way to kind of leverage the non-revenue aspects that MNOs will be gaining?
Okay, thank you. So I'll start with that last one. The non-revenue benefits usually will begin the proposal. So for example, you're working with an audience that either doesn't have access to strong networks, for example, they have weak networks, or perhaps are not frequent users of mobile technology. The opportunity to introduce a mobile service that's critical. So for example, again, take a population like pregnant women. The fact that this is tied into, for example, the ANC clinic visits and the life stage throughout pregnancy creates an opportunity for brand affinity. So if a mobile operator is keen enough to participate in such a project, women can then begin to associate the service with a specific mobile operator. Now, in some cases, it may be across multiple operators. but still you need to be able to present and share that as an opportunity to reach the mother and perhaps provide her with more services beyond just the existing services. So sometimes capturing that non-revenue benefit will require an initial engagement with the mobile operator. Sit down and find out what are they trying to achieve, either through their VAS teams, what are some of their goals and objectives for the year, and then you find that there is some alignment with your existing product or service that you wish to launch. So they're not all out there, but I think if you also look at the proof points, some of those non-revenue benefits are listed there, but usually they are around brand affinity. So it makes them look good that they actually have a project that's having impact on mothers. It could also be something like SIM card distribution. So if you're targeting an audience that may not have access to or can have the service launched and SIM cards distributed to these users of the service, then for them it's an opportunity. It's SIM card distribution, which then has a future opportunity for revenue. Yes, the HNI did post-implementation study, which has again been able to identify the stickiness, but most of the time it's around the same issues. Is it a brand affinity or the fact that a mother is getting a good service on this network operator for her pregnancy? She's less likely to switch operators because she's finding value in the service. So it's either value for the mobile operator or value for the end user. Then the question about the government and MNO engagement and the time it takes, I think it's fair to approach the mobile operator and at least show them what you're trying to achieve, what the outcomes and impact will be, and also to be very honest, let them know that government engagement does take a while, but when they have some insight into what you're trying to achieve, the kind of service that will come through, then they'll be able to advise on how often to engage. So for example, they may say, in the planning phase, just keep us updated, the kind of requirements that you will need. But at the time when you want to fully engage them with regards to integration, it would be important to have tied down some of the other loose ends. So either the government is fully on board with the idea, or stakeholders have been fully engaged on the potential for this ML service. And at that point, then you can begin to talk about developing and integrating the service. Then the time frame is much shorter. And if you approach them right from the beginning, request for services, and yet some of the engagements have not happened with stakeholders.
Great. So now we just have another few questions. This one is a little bit more basic in the initial engagement. How do you keep an MNO actively engaged if they are unwilling to listen or help out? What steps can you advise to be taken to actively engage them? That's one. And then this is one more general, maybe not necessarily for MNOs, but have you considered any alternative means for overcoming literacy issues in utilization of mHealth applications? So this may not be generally for MNOs. And maybe since we're getting to the end, I'll just add the one last question. How long do partnerships usually last? Most health issues in maternal and child health are long-term. So MNOs raise this point, and how long do you often seek for the partnerships to last?
Okay, so again, keeping an MNO engaged, I guess the first thing I would want to tackle is why they are unwilling to listen or to help out. Is it that they do not find value in the proposition that's being offered, or is the request untenable? So you may be trying to reach a large audience using voice services or IVR, and you want the MNO to discount it to zero or zero rate it, and they're finding it a hard sell. Because remember, most of the value-added service managers you meet and interact with, or the marketing teams, have then to present this business case to their management so that they can be given sort of permission to engage in the projects. So if the proposal is showing no revenue opportunity, no brand opportunity, it's simply just discounting the service, then yes, it does become difficult to have traction, and I guess that's why they would be unwilling to listen, because it would be effort expended with no specific return or benefit for them. So in such a case, it would be good to just look again at the project and see where can there be a benefit for mobile operator. What is it that we can aim to achieve that would be useful for mobile operators? For example, the CHW community is not a large community. Usually, there's not enough community health workers in the country against the population. But they are key resource because they actually impact the lives of more than one person each. So a community health worker may be reaching a village or an audience of say 20, 30, 40, or 50, or 100 different people. So being able to leverage such a resource, either to support such a service, would then create a brand opportunity with all the people that the community health worker is reaching. So then you begin to establish that there is potential brand recognition. For example, if they zero rate the service, they could actually request for branding opportunity. So when the community health worker goes out there, they have an apron or a t-shirt that says Ministry of Health, donor XYZ, and mobile operator XYZ. And that creates a brand opportunity for them as much as they're zero rating the service to this platform. So again, the willingness to listen is around value. What's the value in it for mobile operator? Again, it may not be revenue, so don't just think money terms, but it may be an opportunity for brand strength or brand ambassadors in the process as well. And that's how you keep them actively engaged. They can see where this is going for them. In terms of alternative means for overcoming literacy issues, one good example is we have a project in Ghana, and our initial intention was to translate content into English and 4 or 5 other different languages. But we established from the ground that literacy in the local dialect is actually very low. So people speak the language, but may not be able to read a sentence in it. This is a limitation in terms of literacy, but the way to overcome it is, for example, IVR services, although these tend to be a bit more expensive than your basic SMS or USSD service. So there are ways around it, and I think perhaps right now the most significant we've come across is voice. Whether it's automated voice or a call center service, that seems to be the best way to communicate with a population that has challenges with literacy. It is more expensive, yes, simply because the technology used is way more than what it takes to send an SMS. So again, that may be a technology limitation for now. And then, how long can a partnership last? In most cases, partnerships target a year or 2, and I would say 3, not because of a lack of interest, but within 3 years, either you demonstrate impact, some level of impact, which then creates a renewed initiative in the partnership, or within 3 years, the technology that you're using may no longer be relevant, so the service may change, and that may require you to restructure the partnership. So for example, you have a partnership where mobile operator is happy to zero rate SMSs, and that's been going on for a while. After 1 year, you can show there is improved impact, but 3 years down the line, there's more people with smartphones, there's more people with feature phones, and it would cost a mobile operator less to, for example, discount data services than SMS. So then the partnership structure may change a bit within a 2-3 year period. But of course, we hope for longer term relationships and partnerships if the values are very well identified from the beginning.
Let me unmute myself. Great. Thank you, Willie, for answering those. And I know that we only have about 2 minutes, so I'm just going to quickly go back to a follow-up question from one of our participants. And in light of trying to figure out the non-revenue pieces that MNOs would be interested in, who should be doing this research? It seems like a very market business-oriented type of research to see how much a client is willing to stick with the company because of the mHealth service. So should it be the NGOs that need to be engaging in this market research, or who could also be doing that? Is there ways to get funding or finances to support these additional research initiatives?
Thanks for that. It is an interesting question. I would actually say both for reasons that when you make a proposal to a mobile operator, you wish to use their network and their resources in a certain way, and you're projecting certain level of impact and certain level of benefit for them. Perhaps MNE could also try and demonstrate that as part of the value of the service. But also, I say both because the more has happened. So if you say that this could increase the use of mobile money transactions on your network, then the business will want to show that it actually did, and this is from a business perspective. So whether it's a marketing team or a customer service team that will want to follow up with users of all of these services to identify the frequency of use of mobile money or ease of use. So it's actually both who have an interest, and since both are serving the very same customer or client, I would say that's one of the other areas that they should partner. So when planning for your monitoring and evaluation, and you're hoping to get either significant concession or discount or level of partnership with a mobile operator, it's good to find one or two indicators that reflect on the business. And again, like I said earlier, being able to share this back with the mobile operator gets them even more interested. So we get discounts, we get free calls, and it turns out that 2, 3, 4 women in every village have been saved from death during delivery of children or one or other outcomes. Then they begin to see more value. I mean, they'll be happy to discount to whatever level is required for that kind of level of impact to happen. But until they can see it, it remains a commercial decision, and that commercial decision is reduced revenue. So I don't know if that answers the question adequately.
I think, yes, I haven't seen any other questions from that. So we can also try to find a way, if you have any additional questions or any follow-up to these questions, you can send them by email and we can try to continue the discussions that way. Or also further review the document and see if there's anything that can be highlighted in the proof points to make it easier for you to understand what some of the value drivers would be. With that, I'm just going to hand it over back to Francis to close out the call. Thank you very much, Willie, and thank you to all the participants and those who asked really interesting questions that hopefully benefit the larger group of participants.
Oh, Tigis, did you want to say something about maps real quick?
Oh yeah, so one other thing that I wanted to mention actually was that Willie in his presentation had mentioned something about the mHealth Assessment Planning for Scale tool, which was in response to questions about how to scale to community level. And this is something that we've been working on for the past 1.5 years and should be getting out in the next month. But if you are interested in starting to use a trial version, then please email either Francis or me. Those email addresses can be found in the mHealth Working Group emails that we sent out regarding webinar invitation. So please just email us if you're interested. We'd love to have some people try out and test the initial version of the MAPS tool and see how you can assess your work towards scaling.
Great, thanks, Tigist. Yeah, so with that, I guess we can close. A big thank you to Willie for sharing those great insights with us. And I'll send around a link to the slides and a recording, as well as a short survey, just to get some feedback from the participants today. So I should be able to send that around later this afternoon. Thank you all for joining us. And yeah, we should be doing more webinars in the future. So we'll send around those invitations as they come out. Thank you.
Thank you.
Thank you, everyone.